Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about treatment options for toenail fungus infections. Toenail fungus infection is very common. Millions of people around the country develop an infection in their toenails, which causes it to change color, to change shape, to thicken up, and sometimes even become painful. The cause of this is an organism called a fungus, which is basically a microscopic organism, much like a bacteria, that will invade human tissue. In particular, the fungus that causes toenail fungus infections starts off in the skin and simply causes things like athlete's foot, jock itch, and those sorts of common infections many people are familiar with. Unfortunately, that same fungus can actually go from the skin and infect the toenail. Now, the fungus doesn't actually infect the toenail or the nail tissue itself. It basically infects the skin underneath the toenail and then uses the overlying toenail as sort of a scaffold from which it can sort of build its colony, so to speak. Toenail fungus is a lot harder to treat than skin fungus. With the skin fungus, like with athlete's foot, you can just simply rub a cream, a lotion, or spray on that has antifungal properties, which will basically eradicate the fungus and cure it within several weeks' time period. The bad part about toenail fungus is that overlying nail that covers and protects the fungus makes it very difficult to get medication down through the nail itself in enough concentration that can kill the fungus off. Essentially, the toenail sort of acts as a shield because most commercially available creams and lotions just simply cannot penetrate through the nail itself in order to deliver enough medication to kill the fungus off. So treatment basically has to become a little bit more unique. Now, the most common way of treating toenail fungus is to take an antifungal medication, a pill, that will circulate the medication through the bloodstream and then deliver the medication up through the bloodstream into the tissue underneath the nail, or essentially through the skin. The medication itself, and there's a couple different out there, but really only one that's most popularly used, is taken for a total of 90 days or 3 months time period. So it's not easy to eradicate it even with this medication. Traditionally, the medications have had up to about a 70% effectiveness rate when taken by mouth, but that does not necessarily mean that the toenail is going to automatically look better. The nail itself is essentially destroyed because of the fungal infection, and so once the fungus is over and the infection is gone, the destructive changes to the toenail itself are still going to remain behind. So the toenail actually has to grow all the way outward from beginning until end before you'll actually see it cosmetically look different. As I said, the medication is about 70% or less effective, so it does work fairly well, but unfortunately this class of medication can have some side effects. In particular, there is a rare chance that these medications could cause liver failure. This is a process that we don't quite understand. It's extremely rare and generally seen only in people who have pre-existing liver disease, but it's still a possibility nonetheless. So before people are placed on this medication, their livers are evaluated through a simple blood test to see if there's any pre-existing damage. These medications do interact with a couple of other types of medications that use the liver as a pathway to break themselves down. The most popular medication, something called terbinafine, is actually a bit safer to use than some of its sister medications, which have a lot more interaction with other types of medications that do use the liver to break down their components. Another medication that can be used in replacement for using an oral medication, which is the most effective method, is using a topical method. Now, topical medications are obviously much safer because they don't have to go through your bloodstream. There generally isn't any side effects or other problems associated with their use. Unfortunately, though, most topical medications out there are pretty ineffective for treating toenail fungus. There are a few that have, there's one that's been FDA approved to work. It's a prescription medication. I used this medication for a long period of time. Unfortunately, in my clinical experience, I don't find it highly effective. I don't think it works as well as it's supposed to work, and I have not seen a very good cure rate in my patients that I've used it in. A relatively newer medication has come out called Formula 3, which is actually a over-the-counter medication, a product called Tolnaftate, which is a very common antifungal medication. But this particular antifungal medication has a vehicle or a delivery basis in its solution that allows it to get through the nail better and to get the concentration of medication into the skin underneath the nail. It's only distributed through physicians' offices. The company that makes it is very strict about who can distribute it to, because they don't want people simply using it for any nail discoloration, because a lot of discoloration of the nails is not necessarily a fungus infection, and therefore the medication wouldn't have any effectiveness on that. And so, obviously the reputation of the medication would go down because people would view it as not being as effective. So it's controlled in how they distribute it. They only allow physicians to distribute the medication. But in my clinical experience, I'd say it works about 50% of the time, which is probably about as good as you're going to get with a topical medication. It's very safe. It's relatively effective. The only problem is you have to use it for a very long period of time, 8 months to a year, before you're going to see the significant cure rate achieved by it. The good thing about it is that the company that manufactures it is generous enough to offer a money-back guarantee if it does not work, or if you're just simply not satisfied with the medication. But in the amount of times I've used it, I've never had to have any of my patients return it, because we've had some fairly good success and people have at least been happy with the general outcomes they've received. Another treatment course that you can do for toenail fungus is actually getting rid of the toenail. Now, this works if you only have 1 or 2 nails that are particularly infected. You don't want to go through the through the length of having a treatment course involved to get rid of the fungus. And so by simply getting rid of the toenail, you solve the problem, because there's no more nail for the infection to hide behind. You have to remove the toenail permanently. You have to do a procedure that will actually kill the nail roots so it doesn't come back. Because if you just simply remove it, even if you try to treat the skin underneath the nail as the new nail grows out, I often find that that does not necessarily work a great deal of the time. Some people do elect to have that done, and I have had some success with temporarily removing the nail, treating the skin underneath the nail to destroy the fungus, so as the new nail grows in, it's not infected. But it's not a sort of a guaranteed proposition as if you were to simply remove the toenail permanently and then there'd be no nail left to cause any infection. You don't necessarily need to have the toenail. There's normal skin underneath there, and not having a toenail doesn't cause any problems with walking, and for the most part there's not really an appearance issue with it really at all. Unless you stare really closely, then you can notice that someone doesn't have their toenail. Another treatment option that is sort of becoming newer in respect to its use and is becoming more widely available is the use of laser, to basically use laser light wave to destroy the fungus underneath the nail without harming the underlying skin or nail tissue. Now, this is a relatively new approach to doing this. There are some people across the country that are applying this technology. It's rather expensive. It's not covered by insurance, and the average treatment is usually about $1,000. Some people do have to have a second treatment as well. And I've reviewed this study. There's been a major study that was produced not too long ago in some of the journals, and I would have to say, from a personal note, I wasn't necessarily impressed with the results. I think there were some flaws in the study. I don't think the nails were followed long enough to determine the long-term cure rate for this particular infection. Some of the methodology of the study I wasn't in agreement with, and so for my own personal opinion, I'm not so sure it's necessarily any better or more effective, and for the costs that are involved with having to pay for this procedure, because it's not submittable to insurance, patients have to pay cash for it at this point in time. I'm not so sure it's something that I'm going to offer to my patients at this point. If further studies start coming out that are better designed, have more people in them, and follow the study participants for a longer period of time and do show decent results, I'd be happy to introduce that into my practice. But at this point in time, I'm going to kind of hold off on that until the jury is in a little bit more regarding its effectiveness and relative cost basis for that. Well, I hope you enjoyed watching this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may look at my website at www.inpodiatrygroup.com. Thank you.